Welcome to Difficult Conversations with Glen and Grace, where we tackle tough ideas head on. Today, we're diving into the complex debate around whether people should be required to work to access healthcare benefits like Medicaid or even Medicare.
That's right. It's a topic that really forces us to question not just policy, but also our values.
Exactly. At first, it may sound kind of logical. If you're able, you work. If you need care, you earn it. But the underlying question is, who really deserves health care?
And it seems to go beyond just numbers to a deeper moral question. Who gets left out and why?
Yeah, absolutely. And if we look back historically, work requirements aren't exactly new. They came about during welfare reform in the 90s, remember? Under President Clinton's administration with the Personal Responsibility and Work Opportunity Reconciliation Act.
Right. They introduced conditions for welfare recipients, linking benefits to employment or job seeking.
Precisely, but fast forward to recent history, say during the Trump administration, the federal government approved state-level Medicaid work requirements for the first time. Arkansas was really leading that charge.
And what happened in Arkansas is pretty eye-opening. By 2019, reports showed that more than 18,000 people lost Medicaid coverage, not because they refused to work, but because they ran into complexities in the system.
Right, it's like these reporting rules were so convoluted that regular folks simply couldn't navigate them, whether it was lack of internet or not understanding the process.
Exactly. So in essence, the bureaucracy ended up being more dangerous than any potential disincentive to work itself. Isn't that so?
Exactly. And then there's the data. A 2020 Health Affairs study looked into this very issue in Arkansas. It showed there was no significant increase in employment among those subject to the work requirements. Instead, there was an increase in the number of uninsured individuals and poorer health outcomes.
That's a critical point. More red tape and worse health results, with no real benefit in getting people into jobs.
Yeah. And then a 2022 GAO analysis confirmed similar findings. States spent tens of millions on bureaucracy, while coverage losses widened, especially among groups like people with mental illnesses, caregivers, and those with undiagnosed disabilities.
So it's like we're setting up a system that punishes the most vulnerable in our society rather than helping them, right?
Exactly. And what about Medicare? Even though Medicare is distinct since it's not means-tested, but rather based on age or disability, there have been proposals by conservative voices to extend work requirements to people with disabilities, particularly younger ones.
Yeah, that's quite the twist. That definitely opens a can of worms. I mean, considering that many adults with disabilities already face chronic poverty and inconsistent work opportunities, should we really be adding work requirements?
Absolutely not. In fact, the Social Security Administration notes that around 28% of adults with disabilities live in poverty. Imposing work requirements here could actually push them off Medicare, not help them get into jobs.
So, it appears that these requirements, while pitched as a way to foster independence and work ethic, mostly end up creating barriers for the very people who need help.
Yeah, and here's an interesting detail. Most Medicaid recipients already work. The Kaiser Family Foundation tells us that about 63% of adult Medicaid enrollees are employed. The rest are often in school, caregiving, or can't work due to disabilities.
Correct. So if most of these individuals are already working, what's the real problem they're trying to fix? Is it dependency, or is it just an excuse to reduce government spending?
That's the million-dollar question. Supporters argue these policies are about reducing dependency and promoting self-sufficiency. But the data overall show that the intended outcomes aren't materializing. In fact, more people are left uninsured.
And that makes you wonder, why are we using healthcare as a punishment for not working, rather than as a fundamental right to support, well, real productivity?
Exactly. It's like we're caught in a paradox. On one hand, the idea is to encourage people to lead more independent lives, but on the other, these policies end up punishing those who are already battling systemic issues like underemployment or discrimination.
And let's not ignore the fact that minorities, especially Black Medicaid enrollees, are disproportionately affected. Some studies, like a 2021 JAMA report, show they're 2.5 times more likely to lose coverage under these work requirements.
That really sharpens the debate. It's not just a policy question, but a matter of fairness and justice. Healthcare isn't just another job-related benefit. It's a lifeline for many.
Absolutely. Now, I do have to say, though, some might argue that these requirements are intended to foster a culture of work and reduce dependency on government aid. But I'm not completely sold on that argument given the data.
I hear you, but consider this. If policies are built on the assumption that everyone is capable of following a strict work rule, they overlook real-world barriers like access to transportation, childcare, or even a stable job market. It's like expecting everyone to win a marathon when some don't even have proper shoes.
Exactly. That's a strong analogy. And it really underscores the point that these work requirements might be more about political posturing than about actual social progress.
Right, and the broader issue here is what kind of society we aim to create. Do we treat healthcare as a basic human right or as a benefit earned through labor? It's a value judgment with deeply moral implications.
And it gets interesting here, because if we define healthcare as a right, we inevitably have to create a system that's welcoming and accessible, not one built like an exclusive club.
Exactly. And think about it. If healthcare is the foundation, then every individual should be able to thrive without having their access tied to their employment status.
Yeah. Now let's take a critical look. Some might argue that work requirements force people to adopt better habits by making them accountable. But is that really the case? Or does it just create a bureaucratic maze that's almost impossible for many to navigate?
That's a great challenge, actually. The data strongly indicate that it's the maze that causes more harm. People aren't refusing to work. They're just tripping over the red tape and complex rules.
Yep, I get that. And if these policies lead to increased emergency room visits due to untreated health issues, then we're just paying for the inefficiencies later.
Exactly. This whole approach ends up being counterproductive. It not only creates stress for already vulnerable groups, but also strains our healthcare system further down the line.
At the end of the day, it looks like the intended benefits of these work requirements just don't add up when you factor in the human cost.
Spot on. And it's a reminder that sometimes policies designed with good intentions can have very unintended, often harsh consequences. It really forces us to think hard about what kind of supportive structures we need in place.
Indeed. So, as we wrap up, it seems like the message is clear. If we want a truly thriving society, access to healthcare must be ensured regardless of one's ability to, meet arbitrary work requirements.
Exactly. Because healthcare is not just a reward for productivity, it's the foundation that allows us all, even those facing systemic challenges, to have a fair shot at life.
And hey, it just makes me wonder, shouldn't our focus shift to removing barriers and enhancing accessibility, rather than punishing people for circumstances beyond their control?
Absolutely. It's like we need to build a system that supports people holistically. Instead of being punitive, we could design policies that help manage healthcare, employment, and all those intricacies together.
Yeah, right. Well, this was a thought-provoking conversation. I hope listeners, especially those who've navigated this system before, feel heard and inspired to share their stories.
Yes, definitely. We want everyone to engage and debate these big questions. Should access to care come with a price tag tied to work, or should it be guaranteed? The conversation doesn't end here. Let's keep talking about it.
Thanks for joining this deep dive. Keep the dialogue going, and remember, your health shouldn't be dictated by the system's red tape or your time card.
Absolutely. Until next time, keep asking the hard questions, and let's all strive for a fairer, more accessible world.